we saw that adding thyroid very significant in its impact on treating some people that have very hard to treat depressions. And so this is how thyroid is regulated. These hormones, like other things like body temperature and electrolytes and all kinds of stuff, are tightly regulated. And there are sensors in the brain. You get a little off whack, it'll make an adjustment to get back to homeostasis. And so at the level of the hypothalamus in the brain, if you start to have even very subtle thyroid disease, and you get a little bit of a drop in thyroid hormones, that'll be picked up here in the hypothalamus, and it immediately will increase this thyroid releasing hormone, and that causes the pituitary to dump this into circulation, and that's TSH. And TSH is thyroid stimulating hormone. Now, the reason I'm focusing on this seems to be the culprit with some people that have depression. It's not the thyroid hormone per se, but it's TSH. I'll come back to that in just a minute. So, most thyroid disease is an autoimmune disease, and you can have hyperthyroid. Okay, it can cause agitation and anxiety, but most commonly it can cause depression, hypothyroid. Okay. And so most of the thyroid diseases are autoimmune diseases where the body's immune system is attacking the thyroid gland. Much more rarely is cancer of the thyroid. Okay. But it can start off very, very subtly. And so you start getting slight decrease in T3 and T4, but because it is immediately recognized and you crank up levels of TSH, it drives the thyroid to make more thyroid hormone, and you have T3 and T4 levels go back up to normal. 20 years ago, they only would measure T3 and T4, and you'd get a lot of people that had this kind of thyroid disease that, well, your T3 and T4 are okay, but their TSH was not. 10% of people that have depression is caused by thyroid disease. And this is a big deal, okay, because it represents a huge number of people that come to see us. And when people have this, especially when they have grade 2, which is a more subtle version, these people don't have a clue that they've got a medical illness. And they'll come in and say, why are you depressed? Well, I've got this really bad job, I'm getting burned out, or people will offer up very reasonable explanations for why they might get depressed. And it's because people try to make sense of, why am I depressed? Well, gosh, maybe it's this bad marriage or something like that. So they'll come in, and it can just send you on a wild goose chase. You can get them to do psychotherapy or what have you, and it may help a little bit, but it's not going to really work. So this is there really are 2 laboratory tests that really should be routinely given to every person who has severe depression. And one of them is a complete blood count, okay, because anemia is a relatively common cause for people having fatigue. And fatigue can be a symptom of depression, and when people are fatigued, they don't do things that they normally do, and their life starts feeling crummy, and you can get some depressive stuff going on. So that's very inexpensive test to run. The other is a thyroid panel, and what you look for is a TSH. Grade 1 is primary hypothyroid, okay, and this is severe thyroid disease. Thought I had a slide there. Represents 1% of people have major depression. Most of these people go to their primary care doctor, and there are a couple of symptoms that make them go there instead of seeing us. They may have severe depression, but one is they get cold real easily. Okay, memorize that. Keep that in mind. They get cold real easily, and they may notice it, but their spouse will notice it. Like, my husband just keeps turning up the furnace. Okay. Secondly, is their hair falls out, but it's not balding, not baldness. Okay. Hair becomes brittle, and so when you brush your hair, it breaks, and so it's like I'm getting gobs of hair coming out, in my brush. Now, you can have weight gain, but that can occur with depression. You have fatigue, that occurs in depression. You have depressed mood, but usually that cold intolerance and losing a bunch of hair. And occasionally people start getting hoarse. If they wear a tie, men that wear a tie, they'll notice they may have to go to a larger shirt size because they get some swelling in their neck. So the vast majority of people who have grade 1, which is a more severe form of thyroid disease, will not come to psychotherapists. They'll probably go to their doctor, and they'll nail it and treat it. Okay, but these folks are going to go. They're going to go seek out psychotherapy if they do anything. If they happen to go to their doctor just for other reasons, this might be picked up, and a lot of times it's not. Now, let me show you. This is the normal range for adults, and again, this is 16 to 60. Okay, and there are certain variables that may confound this, like being pregnant and that sort of thing. But for the vast majority of people, this is a normal TSH levels. Now remember, if you increase TSH, okay, if you increase TSH, it stimulates the thyroid gland to make more thyroid hormone. Okay, so this is a normal range. Now there are people who go and they get a TSH and it's in the normal range, okay, and they come to you and you say, have you had a physical exam? Yeah, I have. Did you get your thyroid checked? Yes. And what the doctor says is it's normal. And it's normal because TSH is in the normal range, right? But, and for most of us, that's no problem at all. That's not, in fact, that's totally normal. And I'm proud of this. My TSH, the last lab test I got a 1.3. It's the only thing that's going perfectly normal. You know, it's reassuring to know that at least something I'm normal. Okay. Anyway, they're told that it's in a normal range. But if you have TSHs that are above this in the upper half of the normal range, that can cause depression and can really interfere with antidepressants working. And yet the primary care doctor says it's normal. Why? Because it's in the normal range. It is normal for people, except those people that are predisposed to developing major depression. So what do you do? What do you do? If it's up here, well, you give T3, okay? You dump more thyroid in here. Now you don't have to crank out as much TSH. You can try to dry, and it dries it down. And the optimal level for someone with mood disorder is 1.0. And I've had several patients that have been treated for years, and you know, and one of them was, again, one of my favorite patients. He got somewhat better, but I didn't even think about it. This was years ago. I didn't know about this, but this was just information just coming, you know, into the journals. And you know, he came in and he had a TSH of about 2.7 or something like that. And if you take T3, it usually takes a month or 6 weeks or so, and then it gradually sort of drives down the TSH. And now you don't want to get it below here, or what's going to happen? What do you think?
If you get it lower.
Yeah, if you're lowering TSH, what if it goes below here? What do you think? You're going to get hyperthyroid. And people are going to get jittery. They're going to start losing weight. They're going to feel agitated. Okay, so people have hyperthyroid, then their TSH is going to be extraordinarily low. If they have hypo, it'll be very high.